All right, turning back to the latest on those American Ebola patients, Robert Ray joins us on the phone. He's been covering the situation there. Robert, you were one of the first reporters on the scene when Dr. Brantly arrived at Emory Hospital in Atlanta. What are you hearing about the news of him possibly being released today?
Good morning, Stephanie. You know, we have sources that are telling us that Dr. Kent Brantly will be released today, and in the coming days, that Nancy Wrightbull, the aid worker that worked along with him, that came and flew over from Liberia into Atlanta, will also be released. So we'll wait to hear what he has to say. He's actually going to give a press conference, believe it or not, later today. Pretty amazing revelations that are happening right now, concerning the fact that he was on his deathbed just less than a month ago, was given the experimental serum that's made out of an independent company, pharmaceutical company in Southern California, and now about 3 weeks later, here he is being potentially released, sources are telling us, as early as today.
Right.
Pretty phenomenal recovery.
And clearly well enough to be speaking at a news conference, which is incredible. What about his colleague, Nancy Wrightbull? What's the latest on her condition?
Well, what we're told is that she is improved as well and will likely be released in the coming days. That's what sources are telling us. You know, potentially over the course of this weekend. So great news for them, and maybe great news for folks that are suffering from this disease over in West Africa right now. I mean, if in fact this experimental serum was the catalyst to help them. And if they can make this quickly, perhaps this is how we're gonna get out of this over in West Africa.
Yeah, that's an important point to make, and we should point out that Robert is in Ferguson, Missouri, where he has been covering the unrest. Robert, thanks so much for joining us for this breaking news.
Let's go now to Dr. Devi Parapul. She is an associate professor at the NY School of Medicine. We want to thank you for joining us, especially at such late notice, but it is good news. Is this what you doctors would say is a medical miracle?
I mean, I think it's amazing. I won't go as far as to say it's a miracle, just because people do survive with Ebola, even in West Africa, without all the treatment that these two patients have gotten. But it's really exciting. I think it's great news.
As you know, both of these doctors were kept in isolation when they were at Emory Hospital. Now that they are both expected to go home, are there any sort of precautions that family members will need to take in interacting with them? Others?
Well, they are not contagious anymore if they're being released. So they were in a very strict isolation ward. So I'm sure that the doctors have made sure that everything's all right, that all the symptoms have resolved, that the complications are managed. I do think for Dr. Brantly, for example, one thing is that you can keep the virus in your semen for about 12 weeks because that's produced earlier, whereas blood is always turned around. So that's just something to keep in mind. I mean, he would know that himself, just having treated so many Ebola victims. That's one thing, but no, I don't think the family has to worry about any kind of contact with each other. I don't think people who interact with the kids at school or people who interact with the parents necessarily have to worry.
Because it's a virus. Once it's gone, it's gone.
Well, viruses in general, it depends. So like chickenpox, for example, can stay in your body, but Ebola, the idea is that you won't spread it to anyone else. So he's not testing positive for the virus.
But as you heard Robert Ray say, now the questions begin. What do we know about this experimental drug ZMapp? And is it too soon to say that ZMapp is responsible for this recovery?
Well, it's difficult to say if it's responsible because Dr. Brantly did a couple different things, and so did Ms. Wrightbull. So first of all, being healthcare workers, I mean, they could manage things differently when they found out they had symptoms, right? They might start rehydrating themselves or doing other things right away, as opposed to the average person who might get diagnosed who might wonder, do I have a cold? Do I have something else? Did I eat the wrong thing last night? You know, so there's a delay maybe with other people. The second thing is being treated here in the U.S. I mean, they have access to so many other things. I mean, people with Ebola die because they have liver failure, they have kidney failure, they get really dehydrated and lose blood. So these two didn't have necessarily those same issues that other people
So the bottom line, it's very difficult to attribute this healing to ZMapp. Dr. Devi Parapul, thank you so much for your expertise this morning. Great to have you.
And while there is good news in this country, the crisis continues.